大家好. Hi everyone. Let's continue our Chinese medicine talk. Today's topic is seborrhoeic dermatitis. Seborrhoeic dermatitis is a chronic inflammatory disorder affecting the sebum-rich area of scalp, face, and the trunk where sebaceous glands are most prominent. The pathogenesis of disorder is not fully understood. Recent studies have found it is related to the Malassezia yeast. Seborrhoeic dermatitis can affect people of any age, though it is common in infants. We call it cradle cap, and it is greatest in young adults and in older people. It is more common in male than in female. The symptoms of seborrhoeic dermatitis include dry or greasy diffusion scaling of the scalp. This is the most usual presentation. Yellow-red scaling combination of oily, dry skin can develop along the hairline, behind the hair, on the eyebrows, on the bridge of nose, in creased between the nose and the lips, inside ears, over the sternum, on the underarms and the groin hairy area. Permanently hair loss can happen too. The symptoms are worse in winter and better in summer, especially after the sun exposure. I have downloaded some photos from the internet. We can see the skin change. They are very red. They have scales, yellow, oily scales. They're not dry, white scales like psoriasis. I have some pictures of my patient. This is a 3-month-old baby with cradle cap. It's healed later on by itself. Just to tell the parents to give it a wash every day. Don't need to do much. Stop children scratch it. This is a female patient. She is very cautious about her appearance, so she cleaned most of the scales. But we can see the rash is not exactly the same as acne. It has this redness base. The distribution you see on the side of nose, on the forehead, and but we can see at the clinic, there are some overlaps with acne and with psoriasis. We'll talk about this in the Chinese medicine part. In Western medicine, there's no cure for the problem. People use washes, topical agents, for the condition or for the fungals, for the inflammation. Some steroid lotions, gels, shampoo are used. Once you stop using it, the symptoms normally come back again. For infant babies, normally it have self-healing. You don't need to do much. Keep it clean and stop children scratch it. That's the main thing you should do. Now let's come to the Chinese medicine. Chinese medicine think seborrhoeic dermatitis due to overindulging greasy, fatty, and pungent food like chili, curry kind of food, produce damp heat in the body, binding the wind, and cause the skin lesion on scalp and face. It may gradually spread to the other parts of the body. It's easy to understand. So from the skin rash, we can see it's really red with a lot of yellow scales, oily yellow scales. So it's from our Chinese medicine dermatology diagnose talks, we can identify there's a heat, there's a dampness, there's a damp heat. And if there's itchiness, they often combine with the wind. Now, let's go to different types of seborrheic dermatitis in Chinese medicine. The first type is lung and stomach heat. The skin lesion has acute onset, and it is more on the face or scalp. The skin is red in color with exudate, scales with exudate and scales, and has strong itchiness. The patient feels restless, thirsty, and constipated. The tongue is red with yellow coating. The pulse is rapid and slippery. The treatment principle is clear the heat in lung and the stomach. We use 枇杷清肺饮 again. If you want to know the ingredients, go to my talk in the acne, about acne section. You'll find ingredients. The modification is for the strong lung heat, we add 黄芩、栀子、野菊花. For a lot of exudate, we add 薏仁、白术、枳壳 to dry exudate. Now, the second type is weak spleen and dampness retention. These are slow onset. The skin lesions are spread on face, head, behind the ears, chest and upper back, armpit and groin area. They are light red and normal in color, or normal in color, with greasy scales. The stool is loose, the tongue is slightly red or pink with thick and or greasy white coatings. The pulse is slippery. So, but I have to say something here. At the clinic, it won't be exactly the lung stomach heat typical looking, or it's weak spleen dampness retention looking. Sometimes can be something in between. You still have to use your full Chinese medicine diagnose and our dermatology diagnose knowledge to identify the pathogens, and then try to use the herb to address the pathogens. You'll achieve good result. The treatment principle here is eliminate the dampness and strengthen the spleen. The formula we use is 除湿胃灵汤. You'll see the ingredients in my acne talk. See, again, as I said before, there's some overlap between seborrheic dermatitis and acne, but it's not exactly the same. And later on, next type is have overlap with psoriasis. Modification with infection with 蒲公英、紫花地丁. If other modification is the same as above, here is typo modification. Now, the third type is blood deficiency producing dryness and wind. The skin lesion appears dry with lots of dry scales. The affected area is itchy. If it is on scalp, the hair is dry and dull and often drops. The tongue is red without much coating or has thin white coating. The pulse is stringy. The treatment principle is clear blood heat, expel wind, cool and nourish the blood. We use 凉血消风散. I put ingredients here. We can see they are blood nourishing and cooling ingredients. The wind expelling and the itchy stopping herbs like 苦参. So this is the ingredients, and 生地黄 we use the high dosage. So that's it for seborrheic dermatitis. Again, as I said, when we see this, don't panic. Use your knowledge to diagnose it correctly first, and then address every matter. See, address the redness, the papules, the scale, And itchiness, if it is there, if you find a deficiency, address deficiency. If you find excess, you address the excessive conditions. Okay, our this session dermatology talk is finished here. Thanks for listening. I'll see you at the next session. Thanks.